or I still find that my skin is still have a bit of pigmentation. Why is there still such issue when you are using the best product that you can find, right? And therefore, it is important to personalize the product according to your condition, your age group, and your concern. So this is where we're looking at a new skin treatment approach. So we want to target the condition and treat accordingly. And hence, the active ingredient is very important. It can't be prescribed just without seeing a doctor. You will need the doctor to assess the skin to be sure that that is what you need before you are being prescribed the product. So it's actually a prescription serum because the product needs to be personalized. And in order for it to be personalized, right, we need to be able to assess your skin and find out what is your skin condition. And once we have figured out what is wrong with the skin, then we will be able to know for sure what would be the best ingredient to put in, and then we will then mix it in. Yeah. So you can see that this range of product actually have done over 5,000. It's not that this product has done the study. It has accumulated all the various clinical study. So you look at before this product was produced, you look at over 5,000 clinical study. And from there, they select all the ingredients that has been proven to be effective. And with that, they also source it from pharmaceutical supplier before we put them together. And with it, right, we will have all these ingredients that are well studied, because each of the ingredient is actually fresh. And only when we have analyzed the skin, then we mix it into the serum to produce the final product. So it's fresh and it's not kept there like 1 year shelf life or 2 year shelf life. It is only added into the product when we have analyzed your skin. And of course, then we have many possible concentration and many possible combinations. So you look at it, this is what we have. The 19 ingredient that is possible to be added into the product. And you notice that there are color code for yellow, got pink, or that is Shirley's favorite color, pink. And then you have red, you have blue, you have all these orange. And what is the meaning behind it? There is actually a meaning behind it. When we look at your skin condition and the stress or the damage done to your skin, the condition, it can be divided into 8 different groups. It can be due to environmental stress. It can be a loss of the extra cellular matrix. It can be redness. It can be loss of the barrier. It can be thickening of the skin. Keratinization means the outer layer of the skin is thickened. It can be also a sebum, that means oiliness, which is what it was complaining of. Pigmentation that Paul mentioned about. And sometimes you get this floral disorder, that means sometimes you get this redness to the skin or even acne problem. It can be due to this cutaneous flora, that means the normal germs staying on your skin. Yeah, so we always need to have some germs. So actually germs itself is not a bad thing. It is the imbalance that gives problem.
Right.
Yeah. So based on the analysis, depending on what is the main problem that your skin will have, whether it's environmental issue or skin or redness, we will then select the ingredient. You will notice that there is different ingredient for each of the concern. Yeah. So depending on your skin, we will then add in the ingredient. And that's where the challenge is. After knowing the skin condition, we still need to decide which product to put in. And this is, so there's 2 parts. One is the diagnosis, and the other one is to select the correct ingredient. And that is where you need the doctors to ensure that it's the correct ingredient. So some people, for example, if you're allergic to aspirin, then we cannot use things like salicylate. Or if you have an allergy, skin allergy to aloe vera, then we will avoid aloe vera as well. And for people with very thin skin, we will want to avoid things like glycolic acid. So because you need someone who know the effects and side effects of each ingredient well in order to select the correct ingredient for you. So 8 dysfunction and with 8 functional therapy. Yeah, in this case. In putting the product together, there's this serum, and this serum actually has is what we call the carrier, and within it, it has a lot of active ingredient inside as well. The whole process is actually quite fast. You can see that we will select the ingredient, add it in, and then we'll have a shaker to blend it to make sure that it's well distributed before it's been given. And within the serum, we have this biomimetics peptide, which is good. It contains all the growth factors. It contains some of these stimulants for your skin. It contains vitamin E, omega, and hyaluronic acid, which is very important for hydration. So this is often a question. They say how much is enough, right? So if you look at it, once you receive your serum, this is what you will need. Yeah. For the face, you need 4 drops. For the eye area, if you are applying on the eye, it's 1 drop on each side. And the next 3 drops if you do that. And for the back of hand, is 1 drop on each side. So you can apply this serum on many areas, to the face, to the eye, to the neck, the hand, and even the neck line. So if you want to know a little bit more, one of the ingredients uses this oil, and it has all the essential oil that is useful, ALA as well as antioxidant. So we are big on anti-inflammatory, and this is some of the ingredients inside there that help on that. And this has been studied, and it finds that it not only reduces inflammation, it actually helps to repair the cutaneous barrier. And the protection is very important. Once the skin is dry or it cracks, then all the irritants or allergen can penetrate the skin, causing inflammation. Yeah. So this is one of the key factors of skincare. You have to reduce inflammation and repair the protection and hydration. So this is what a biomimetics peptide does. It actually mimics the activities of natural polypeptides to stimulate the skin. Of course, you can see that there's a whole range of it, and many of it. And because it is a synthetic peptide, sometimes people say that when I look at product, is it better to have a synthetic or organic? The advantage of synthetic is that it is a pure form. You can control how you manufacture it and the quality of it. Organic, not that it's bad, but we also have organic substance like the aloe vera. But the issue with organic sometimes is that the risk of allergy is actually higher. That is quite interesting, right? So organic sometimes have higher risk of allergy reaction.